Living a bad neighborhood.
There's my audience. Okay, my speech is on H.R. 3590, which is also known as the Patient Protection and Affordable Care Act, or colloquially known as Obamacare. This is a piece of legislation that was passed by the 111th Congress on March 23rd, 2010. It composes of about 906 pages and is a 12.5 page table of contents, which, as you will see later, is a quite lengthy bill. The bill itself was actually passed 219 to 212 in the Congress. Now, this was a very, very narrow battle, and it was a very narrow passing of the actual bill itself. No Republicans actually voted in favor of the bill, while 34 Democrats voted against the bill. The bill would not have been passed unless there was, or without the Democratic majority. Like I said, it's a very, very long bill. If you took the average length of all the bills from the 80th Congress all the way up to the 100th Congress, which is a period of time from about World War II up until the late 80s, the average bill length was about 5 pages. If you think about that, that's a 12-page table of contents for this bill, and that's 2.5 times the average length of any other bill. In fact, this is actually the third longest bill by word count of anything that the U.S. Congress has passed. Some of the other bills that have been passed that are extremely long was in 2009, it was an American Care Act, and there was also the No Child Left Behind Act. That was the 5th longest bill that was ever passed. There's many, many, many major points that I can bring on and talk to you about with this bill. However, really there's only a handful of them that are actually going to be applicable to any one person. So I'd like to start off by saying with Section 2711 and 2712. These are laws that establish, or this is a part of the law that establishes a lifetime limit on what sort of benefits an insurance policyholder is allowed to reap from the government. It says that there is no lifetime limit and there's no unreasonable annual limit of what benefits can be received from the government, such as tax credits, refunds, and reimbursements. If you do it correctly, and in a perfect world, you would actually be able to reap, an infinite number of benefits if you wanted to. There's also another section of 2712 which refers to that you cannot be kicked off of the plan for any reason. You can terminate the plan yourself for whatever reason you may have, but the insurance company does not actually have a say in whether or not you can be discontinued in their enrolled program. Another section that's very, very important to talk about is Section 1302, which which establishes a minimum amount of health care requirements that a certain insurance plan has to cover. The insurance plan has to cover ambulatory services, emergency room services, hospitalization, infant, newborn, substance abuse and mental health services, as well as prescription drugs, rehabilitation services, which is not necessarily to drug use, but post-op surgery, rehabilitation to various sort of injuries and stuff like that, with prescription drugs, laboratory and preventative care services, and pediatric care services. There is a caveat to all of this, though, is that Section 1303 says that abortions do not have to be covered in this. Because of the sort of, political and religious sensitivity that people have, they decided to make that an exempt service. Section 1333, which I feel is a extremely important section of the entire ACA, and is one that I personally find to be the most enlightening. Section 1333 explains that it talks about how the exchanges are to be established in each state. An exchange and a market exchange in a state is a lot like if you go on Trivago.com. It's sort of a compilation of all the various hotels, or in this case insurance plans, that you can have in a certain agency or in a certain state, and it gives you a bottom line price of all of them. The intention of this was to increase competition, as well as expanding boundaries in which an insurance company is allowed to operate. The law states that each state must establish their own marketplace exchange, and they must establish two companies, or they must have two companies in each of their marketplace exchanges. One has to be nonprofit, something like Kaiser Permanente, and the other one can be a for-profit entity of their choice, or it could be another nonprofit entity. As long as there's at least one nonprofit entity, that's fine. It says that unless there's anything illegal about each state, there is no, or if there's a state law that says that a certain company, it is illegal for them to operate in that state, otherwise there is no actual legal barrier, at least in this law, that talks about establishing sort of what I would say, turf of a certain insurance company. There's no reason that Kaiser Permanente could not operate in, let's say, Kansas, where they don't operate currently. There is no legal barrier. However, Kaiser may not have any sort of infrastructure established there. It may not have hospitals and various things that they can consult with. And obviously there are logistical barriers, but as far as an actual legislative barrier and prohibition, there really isn't one. Another thing that they talk about are the various tax credits and what they call cost-sharing incentives. This is described in Section 1401 and offers various tiers of coverage. You can have very premium plans, or you can have more gutted plans. Once again, the minimum plan must be it must contain at least those basic essential health benefits. Generally, the tax credits are given by the government, and really the majority of them apply to those who live at the federal poverty line all the way up to 400% of the poverty line. For my own family that I live with, there's 5 of us. The federal poverty line stated for 2017 is $28,780. If you were to make less than that of taxable income in a 5-person household, you would actually be exempt from requiring coverage. Along with this, you have Section 1411, which talks about what info is actually asked for. There's a lot of talk about how you can't be turned down for coverage and you can't be denied coverage because of a pre-existing condition. And 1411 seeks to clarify that, of what you're allowed to do and what you're allowed to ask for in determining the price of the premiums that you have to pay. It's actually rather vague, and they really don't ask for a whole lot. They ask for the name, the address of where you live, your date of birth, your citizenship or immigration status, which includes offering your social security number for various confirmation purposes, and your stated income that the IRS recognizes, and that's to determine various tax credits and cost-sharing protocols that you have to have. Now, there are exemptions if you don't actually have to have insurance if you fall into one of these categories. If you live below the poverty line for how many people in your household, you don't need insurance. If you are of a certain protected religious sect, you don't need insurance. If you are part of an Indian tribe and you live on a reservation, you do not need insurance. If you are part of some sort of healthcare sharing society, various religious convents and things like that, you don't need health insurance. And a lot of these are actually defined by the secretary, and he or she has the final say in a lot of them. Like I said, this is a massive, massive law, and there are so many things that I could be talking about, but these are the majority of the points that I like to address. The final thing I would like to talk about are a lot of misconceptions regarding the Affordable Care Act. It's one of those things that, because of how landmark it is and how much media coverage there has been on it, people have over the years gotten sort of there's been a few misconceptions and argumentum ad populum that may or may not be true. One of them talks about the death panels, the idea that at a certain age you have to go before a panel of bureaucrats and they determine healthcare. Well, that was actually explained in a previous bill, H.R. 3200, which was not passed. There's actually nothing in the Affordable Care Act, which is H.R. 3590, that actually talks about this at all. The individual mandate, like I covered earlier, there are some people who are exempt from actually requiring to have health insurance. If you wanted to, you could go, you could live off the grid, you would not pay taxes, and you would not need to gain health insurance. People are also worried, and some of this may be perhaps sugarcoating it, but the increase of cost and the cost containment that the Affordable Care Act was supposed to utilize. Well, a lot of that comes down to the technological imperative, which is the idea that a new, more expensive technology is automatically presumed to be better than a previous, less expensive technology, as well as the very, very apparent suing culture in this country. Last one is what I sort of refer to as poor Joe's chemotherapy. The idea that insurance is going to cover a certain person's chemotherapy or massive operations that are going to be extremely costly. That's not necessarily true too, as many of the healthcare plans require what they call the essential health benefits, which was previously discussed. By and large, it's a very, 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 very large bill that really touches on a lot of things, and regardless of whether or not it could be good or bad, it is something that is extremely important for people to be reading about, and definitely something to be informed on. So I hope you guys have enjoyed this speech. Thank you.